So what I'm saying is just withdrawing from alcohol does not solve the problem. You got to build up the system. So this will give you an idea how when we look at this, how to think about it. Okay. So people have poor genetics, they have less neurotransmitters and receptor sites. That's a congenital, what you're born with. Then we have toxic exposure. Lead, mercury, cadmium, herbicides, insecticides. Now, I'll just point out that animal tissue has about 96% of the pesticides and herbicides and insecticides as compared to eating vegan. Okay. And I often will use, I'm not trying to advertise different things. So I'm just going to say I'll use things to pull out the heavy metals that are oral rather than, intravenous. And then what are the symptoms? Everything I just said about it: depression, addictions, food, drugs, sex, gambling, violence. All these stimulate dopamine so you feel better, but it only works for a little bit and then you run out because your normal system is suppressed. So that's the thing about, I was explaining, like pornography, you're stimulating the frontal lobes and you're getting a false, let's say, increase, okay, in the dopamine, but it isn't real. So you're using it up and you deplete it. Normal sexual behavior, I mentioned 3 times a week. For men, it was longevity and so forth. You're actually building it up because it's part of a total process. In other words, you're not substituting and creating a false high and, in essence, suppressing your normal ability to regenerate. That's the concept that is out there, in terms of understanding, and it makes a lot of sense. Okay. And now, poor in utero nutrition by the mother, but I'm going to say poor preconception nutrition by the mother and father, situation, emotional stress, poor adulthood nutrition, poor infant and child nutrition. All these contribute to anxiety, alcoholism. Again, alcohol, what's it do? Increases dopamine, but it's temporary. It doesn't solve the problem because eventually the system wears out and it's not a complete cycle. This will give you a feeling for what we have to do to rebuild the brain. It's a very holistic program. Next slide, please. Okay, so the poor genetic expression, we were talking about lower dopamine levels and receptors, lower serotonin levels and receptors. In other words, receptor sites on the tissue, and lower endorphin levels. Those are your sense of well-being. Often we see family history of depression, alcoholism, ADHD, drug addiction, schizophrenia, and anxiety. And then poor prenatal nutrition and poor intrauterine nutrition. And that's where we get the biologically altered brain, which is what we're talking about. So I'm doing kind of broad strokes about a lot of this. I will be focusing more on nutrition, but I can't just talk about nutrition when there's so much more else going on. Next slide, please. So this is just one more diagram. Toxic heavy metal exposure, emotional stresses in children, early drug use. I mean, kids getting the drugs when they're 8 years old. And we get biological altered brain in adulthood, and then fully altered brain. And then you get the addictive brain because people are just doing whatever they can to get a hit because they don't feel good. Anxiety, Tourette's, obsessive compulsive disorders. Okay, I think you have a bigger picture now. Next slide, please. So this is the effect of prayer and meditation nutrition for the brain. Now you see below it says hippocampal. That's the area you want to really grow. It has amygdala. That's kind of emotional control. And when people meditate, these other areas grow. The frontal lobes, anterior cingulate is like the heart compassion area. The parietal lobes have to do with kind of a more mystical experience. And when the Harvard study shows that many of these areas go, but the amygdala, which is aberrant emotions, anger and so forth like that, that are more than should be, they actually shrink. Next slide, please. That's exciting. So frontal lobe with prayer, focused attention, it protects against age-related deterioration that we see with dementia. Just what we're talking about. This area will shrink, may shrink with age, and I'm saying we can grow it with age too. Okay, so we don't have to have mental loss and decreased mental functioning. The anterior cingulate area is with compassion. The neurological heart, the parietal lobes have a sense of separation and more religious experience. And the limbic system gets deactivated by prayer, so you're not so emotionally out of balance. Next slide, please. And this is the Harvard study. Literally, physically, meditation rebuilds the brain in 8 weeks. That is so cool. I mean, you know, it's everything I've been talking about, but to see this study, it was like, oh, wow, they did it. Next slide, please. Now, we're talking more about food now, but we're looking at what we call, inflammation. And there's 2 areas that we're looking at. Gluten products, not just wheat, but different gluten grains, and a high carbohydrate diet. So when Joe Furman talks about, well, he sees a lot of people with vegans with brain degeneration. I look at the high carbohydrate diet, which I don't support because it stimulates brain inflammatory pathways. What am I saying? So next slide, please. Okay, the gluten sensitivity certainly can relate to schizophrenia. I just remember, it just kind of blew my mind in my psychiatry residency, where they showed a movie of this person, and she had 1 bite of wheat bread, and she went totally crazy. Now, it was make a point, which is that's how sensitive we are. It's pretty mind-blowing to see that happen. The person, normal, everything, she hit gluten, wow. So these things are very real, and I think we kind of think, oh, it's all in your head. Well, it is all in your head, but it's also in your head physiologically. So these are things that we see: bipolar disorder, depression, autism, ADHD. The supplements I'm going to talk about, as well as the diet, are going to address these things. Next slide, please. Now, to me, this is a really important study, Journal of Alzheimer's 2012. I'm just going to read it because it's so important. Older people, and we're talking people above 60, eating a high carbohydrate diet. Get the word high carbohydrate, because we're told a lot in the vegan world that you want a high complex carbohydrate diet. People are talking about 70% carbohydrate. Yeah, well, here's the result. Have nearly 4 times the risk of developing mild cognitive impairment, MCI, which are precursor to Alzheimer's. So when we have a doctor, like Joel Furman saying, oh, well, I'm seeing a lot of people who are vegan, that's because in the vegan world, there's a push of high carbohydrate, low fat, moderately low protein diet. Well, you can do high carbohydrate, but as long as you don't mind 4 times risk of developing MCI. And as Joel Furman points out, Alzheimer's. So what I'm telling you is, for brain diet, we want, if you're eating fat, healthy fats, particularly if you're eating not animal fat, which are high in pesticides, herbicides, 95, 96%, 42% less likely to experience cognitive impairment if we're eating healthy fats, which I'm calling plant fats, like avocados, like nuts and seeds. Okay? So I'm saying that. But I want you to get it really, really here, because this is not the usual message people get. 4 times the risk of MCI or Alzheimer's eating a high complex carbohydrate diet. That should wake up a lot of people when we, particularly the vegans, making these suggestions to eat a high complex carbohydrate diet. Just for your information, when I'm treating diabetes, we have a 61% cure rate of type 2, meaning all blood sugars are normal, and that's in 3 weeks. For a, quote, incurable disease, 61%, when we put them on a 35% complex carbohydrate, that's as much as they do. People who don't have diabetes, we're looking at 25 to 45% carbohydrate in the diet, not 70%, not giving you 4 times higher risk of MCI. And that begins to explain partly why Joel Fuhrman has that observation. And I'm going to just tell you, I didn't see that in writing, but the other day when Brian Clement and I were being interviewed, for this seminar, that was a question that was asked. Well, how do you explain this with Joel Fuhrman's observation? This is how you explain it. Next slide, please. So, one of the big problems we have is when sugar goes up, neurotransmitters go down. So we see, and I see, that sugar, and I'm talking about glucose and fructose. Please get the idea. Fructose is up to 10 times more brain inflammatory as glucose. Okay? So when the blood sugar increases, it depletes neurotransmitters of serotonin, epinephrine, norepinephrine, GABA, and dopamine. So I really pretty much teach a no sugar diet. Now, when I say no sugar, I'm talking no white sugar, no brown sugar, which is the same thing as white sugar. And I'm talking, like Brian, not a whole lot of fruits. If you're going to do any fruit, which I don't recommend, particularly with my healing diabetes natural diet, bilberries, blueberries, green apples are the lowest in the sugars, and I don't recommend that until people are healed of their diabetes. Next slide, please. So, Robert Lustig put it nicely. Nature made sugar hard to get. Man and women made it easier. Okay, and you see the skeleton, because that's what we're talking about. Next slide, please. Now, this is important. I mentioned fructose is not better. It is also associated with impaired glucose, insulin resistance. And I want to point out, it's a very important concept. The brain can also become insulin resistant besides the body. And therefore, it can't get the glucose, which runs the brain. Fortunately, ketones make it work. And when we see fasting, we see people move from glucose to ketone metabolism. The key ketone is beta hydroxybutyrate, which gives you about 8 times the amount of energy per calorie as does glucose. So it's really the best, and that's what we've noted with the fasting. So even though fructose has no immediate effect on blood sugar and insulin, again, that's the point, it's likely to cause insulin resistance in the brain as well as the body, and increased storage of calories as fat, because the liver then starts to convert calories to fat rather than use it to, for energy. Next slide. So I'm making a point as clear as I can based on my experience in how do we heal type 2. We also heal type 1. I don't want to get into that. That's a different talk. which I gave last year. Okay. So what we're seeing is the people with the most amount of brain cell loss, which is what we're talking about, have an A1C, which is the amount of glucose that's that connects itself to protein and also to the DNA structure in the body. So their brain cell loss is almost double the higher A1C is. So it's just not a marker of blood sugar. It's a direct relationship between the hemoglobin, A1C, and depression, but really brain shrinkage. Let's get the word, brain shrinkage. So if you're going to grow your brain, forget about having sugar in your diet. Next slide, please. I will answer questions at the end. I couldn't resist the other one about sex, but I'll answer questions at the end so I can kind of get what I want to say. So this is what David Perlmutter in his book, Grain Brain. I thought he did really good work. A diet heavy in inflammatory carbohydrates, which mostly they are, low in healthy fats, messes with the mind in more ways than one, but let's say messes with the brain in more ways than one, affecting risk not just for dementia, but for common neurological ailments, ADHD, anxiety, and really, if I'm going to treat ADHD, we have to go all organic. That will knock out 50% of the symptoms, heal 50%, and then we go to no sugar, okay? Anxiety disorders, Tourette's, mental illness, migraines, and even autism. So just kind of get the picture. Inflammatory carbohydrates, they do inflame the brain. Next slide, please. So fat is the preferred fuel of human metabolism, and it's been that way through evolution until we started farming about 10,000 years ago. Next slide, please. Now, this is really important because along with this high complex carbohydrate diet, we just have this cholesterol fear. And this is one of the second reasons I think that vegans tend to get more Alzheimer's, because people with the highest cholesterol scored higher on cognitive tests than those with lower cholesterol levels. That's pretty straightforward. That's Boston University, 2005. Australian National University in Canberra, I've been there. People whose blood sugar is on high end of normal range have a greater risk for brain shrinkage. This is our type 3 diabetes. Okay, that's what we're talking about, brain shrinkage. Next slide, please. So this is I'm really talking more about cholesterol here, but Netherlands, Alzheimer's have lower amounts of cholesterol, free fatty acids in their cerebrospinal fluid. That is really important. As 2007 study showed that people who regularly consumed omega-3, this is one of the supplements I'm going to talk about, they were 60% less likely to develop dementia than those who didn't regularly consume such oils. That's DHA and EPA. Those are your big players there. So keep that in mind. It's pretty essentially important here to get those in your diet. Next slide, please. So, the National Institute of Health, high cholesterol is associated with better memory function. This is the point I'm making, why people, vegans will tend to will have more memory dysfunction. Next slide. Now, I just want you to understand, I put a bunch of references in because I didn't want anybody to say, oh, you're making it up. Next slide. I'm just going to the references because keep going. Keep going. You see, there's a lot of references that point what I'm talking about. Keep going. This is show and tell just to get the idea that this research is well documented that I'm talking about. Okay. Pretty good. You see, it's a lot, isn't it? Okay. Women who have a cholesterol of 270, okay, which people think that's off the scale, had a 28% increase in longevity and cardioprotection. 270, 28% increase in longevity. That's a pretty amazing statement. Next slide, please. And this is a study of people between the ages of 20 and 74. And this is the 270, 28% lower mortality rate. The women had a cholesterol of less than 193. So we're debunking the cholesterol thing. It's been pretty debunked. We're lagging a little bit in the vegan world. That's why Joel Fuhrman's statement was so good. Not that I don't know exactly what he attributed to, but this is what I'm attributing to it. Next slide, please. There's a meta-analysis. This is 340,000 people, 21 different studies. What did they find? No difference in risk of heart disease between people with the lowest and the highest intake of saturated fat. So this whole high fat fear, HFF, has been leading us the wrong way. And it actually decreases our mental function. Besides, it doesn't make any difference in risk of heart disease. 21 studies, 340,000 people. That's a lot. That's a significant study. Next slide, please. And this is the best study. Archives of Internal Medicine, 2009. Okay, and what did they find? Next slide, please. Bottom line, no evidence to support the widespread, I'm going to call it mythical belief, that limiting saturated fat intake is beneficial or protective for heart health or longevity. If you just get that, you're going to make your lives a lot better. Next slide, please. We need cholesterol. And this is something I learned in medical school, kind of unrelated, but basically people with low cholesterol tend to have a lot more depression. How about 6 times more suicide and double the amount of depression? So if your cholesterol is less than 159, it's dangerous, especially to mental, emotional, and physical health. So that's why, as a psychiatrist, I'm looking at this from a whole different angle. It's like, wow, that's great. Go low cholesterol, and this is not so good. Next slide, please. So here's the problem with low cholesterol. Emotional imbalances, increased depression and suicide. I mentioned up to 6 times more suicide at the lowest levels, double if you're in the lowest 25%. Violent behavior, stroke, accidents, hormonal problems, memory loss, which is what we're talking about, and Parkinson's. Next slide. So, a strong causative association with low cholesterol. And low cholesterol is associated with decreased serotonin, which is kind of antidepressant in the neurons. Next slide, please. So serum cholesterol concentrated more 6 times the risk of committing suicide. That's the point I'm making. Next slide, please. And if you're in the lower 25 percentile, suicide doubles. Well, as a psychiatrist, this is pretty important. So getting a cholesterol, because we're not even worried about heart disease unless you're above 270, okay? And I'm going to put the lower level at 159. And my cholesterol is 159, and so I'll leave it at that. Suicide is double. Next slide, please. So it's increased suicide, accidents, and violence because the brain is made of different estimates, at least 60% fat. So when somebody calls you a fathead, take it as a compliment. Okay, sorry, next slide. Now, along with other fats, I'm going to go to the omega-3s, which are very important. That's your DHA and EPA. And I kind of got into this in a different way. I saw a lot of women who were depressed postpartum. And I did research, and it's like, oh, I get it. The baby's taking the DHA, and the mother without appropriate DHA gets depressed. So I began supplementing with DHA and also with EPA to keep it balanced. And within 3 to 6 weeks, those 90, really more than 90%, at least 95% of the depressions were gone, postpartum depression. It also helps with depression in general, but postpartum depression, it's a DHA deficiency, almost for sure, unless you were previously depressed. So the omega-3 DHA EPA is associated with at least 96%, 96,000 premature deaths, and adequate DHA decreases the risk of premature death up to 85% when at optimal levels. The research isn't as, next slide, the research isn't as quite as clear as I would like it, but what I will say is we want to try to get about 1,200 of DHA and 300 to 400 of EPA per day, roughly speaking. Okay, so why is that important? Because they're a big part of brain tissue, particularly the brain and the eyes. That's why the baby is taking all the DHA from the mom so it can develop its brain and get its eyes going. As I mentioned, it treats postpartum. EPA is particularly good for bipolar depression. It really does make a difference. As a psychiatrist, I will always use that with bipolar. Since I really actually don't use psychiatric medications, I'm doing it with orthomolecular approach. Okay, and it improves mood regulation. Next slide, please. So, what are we saying? DHA EPA builds the healthy brain, helps your memory, cognition, helps with sleep, neuromuscular function. I mean, this is pretty important, okay? Releases GABA, which helps you relax and helps against depression, panic attacks. So it's really important. EPA, DHA. Next slide, please. And it's the preferred fuel for your heart. I mentioned the so atrial fibrillation, high omega-3, 85% lower risk of dying from all causes. So we got to have a certain amount in there. Lowers blood pressure, improves the cardiovascular risk factor, meaning it decreases your cardiovascular risk. That's a winner. Next slide, please. Okay, little side effects: protect your skin from cancer, helps decrease prostate cancer, and in women, decreased rate of breast cancer by 50%. That is really good. That's the high omega-3 to omega-6 ratio. That's a winner. Next slide. Okay, and again, lots of references just to make the point, because I understand that basically the theme has been low fat, high complex carbohydrates. So look at the references. Lots of evidence supporting what I'm talking about. Okay, just keep going through. I just want, again, the impression. Now, what I want to talk about a little bit, we have a few more minutes here, is so what are the foods that are really bad? We're talking about nutrition, we're talking about wheat, the gluten, because it creates inflammation. High carbohydrate diet, we also mentioned 4 times higher rate of senility or MCI. Sugar, these are your big brain killers. Things like green tea actually help the brain because catechins that are in the green tea stimulate neuron growth. Okay. What are really not so good? Beer with nitrates, fried foods, microwave popcorn, processed cheese. I'm sure a lot of people who are listening to this already have that figured out. So what I'm going to just summarize just a little bit here, what we're talking about is that, what decreases brain function and size, we've got it. What increases it, one thing that happens is we start to get an overactive microglia, which are repair cells, migrating repair cells in the brain. And that also connects to low insulin sensitivity because we get insulin resistance in the brain. Low oxygen, so I recommend pranayama, breathing exercises. That's pretty important, particularly if you go less than 20%. When you're wearing these masks, you do go less than 20%, unfortunately, and it is causing brain damage, but that's an associated topic. Excess inflammation, and oxidization of the brain. So what are some kind of brain-growing foods? I mentioned blueberries, blackberries, apples, cinnamon, leafy greens. We'll go that in a little detail. Avocado, it has certain substances that are really, really good for you. And the coconut oil has MCT. Now, a lot of people say you shouldn't have just the extracted oil, but again, we are talking about deficient soils and deficient food. So it's not so easy, particularly with age, to build your brain. So we need a little support. So I'm talking in particular, when you get over 60, these are things you want to consider. So coconut is good. MC mid, chain triglycerides really does play a role in getting your ketones going. Obviously, lots of fruits and vegetables, but more on the vegetable part of it. And there's certain herbs like ginkgo biloba. What does it do? It increases brain circulation. It increases the cell growth in the hippocampus. If you recall, the hippocampus is the area of memory and clarity of thought. Okay? So it's pretty important, and also creative brain function. I mentioned dancing, and I wasn't actually joking. We started with that, but it creates a neuronal connectivity. It connects us kinesthetically and rationally, and really a muscle awareness. So there's a reason why I like to dance. I mean, I like to dance, okay? But I'm giving you a scientific reason why it's good to dance. Mushrooms actually play a really important role. So we'll go raw or cooked, but I'm going to do cooked because that's what mostly people do. And if you're doing 2 helpings of cooked mushrooms a week, your mild cognitive decline, MCI, okay, decreases by 50%. That's a significant statement. There are things in mushrooms that's not totally worked out, but there's a thing called ergothianone, and it's the one that seems to be most associated with MCI in terms of helping create less MCI. Dried mushrooms, and I think golden mushrooms are good, oyster mushrooms, shiitake mushrooms, and even white button mushrooms. So I'm giving you kind of a flavor for some of this. There are certain oil, again, I know people have feelings about extracted oils, but it does appear that olive oil is very helpful. And herbs, rosemary does stimulate brain function, as well as sage, which blocks acetylcholine esterase. ACH, acetylcholine, builds your memory. And acetylcholine esterase breaks down the acetylcholine. So sage helps improve that. And the other one is peppermint. And then we're looking at certain nuts that are particularly good for this. Macadamia nuts, turns out, because they're very high oil, is one of really the best. And pecans. So macadamia nuts and pecans seem to be the best for regrowing the brain and having high amounts of omega-3. Then we have different herbs, we have St. John's wort and certain vitamins, and minerals, and zinc and potassium. Melatonin also helps a lot with memory, it turns out. Iron, and particularly for women, and then magnesium.